Hi, this is Melissa Luna, and here is your August 2023 Medicare Minute on Medigaps. As you may know, original Medicare Part B covers 80% of the cost of most services. But what about the remaining 20%, or even the other out-of-pocket costs like deductibles or inpatient copayments? Today, we will discuss Medigaps, which can help cover out-of-pocket costs with original Medicare. Point 1. Understand Medigaps. Medigaps are health insurance policies that offer standardized benefits to work with original Medicare. They are sold by private insurance companies. If you have a Medigap, it pays part or all of certain remaining costs after original Medicare pays first. Medigaps are designed to cover outstanding deductibles, coinsurance, and copayments. If you have a Medigap, you will generally not have any out-of-pocket costs for an inpatient hospital stay or outpatient doctor's visits if your providers accept Medicare assignment. Here in New Mexico, depending on when you became eligible for Medicare, you have up to 10 different Medigap policies to choose from. They're referred to as letters A, B, C, D, F, G, K, L, M, and N. Each policy offers a different set of standardized benefits, meaning that policies with the same letter offer the same benefits. However, premiums vary from company to company. Remember that Medigaps only work with original Medicare. If you have a Medicare Advantage plan, you cannot buy a Medigap. Point 2. Learn the best times to purchase a Medigap policy. If you wish to purchase a Medigap policy, you need to find out the best time to buy one. In New Mexico, insurance companies must only sell you a policy at certain times and if you meet certain requirements. If you miss your window of opportunity to buy a Medigap, your costs may go up, your options may be limited, or you may not be able to buy a Medigap at all. Under federal law, you have the right to buy a Medigap policy if you are at least 65 and enrolled in Medicare, and you buy your policy during a protected enrollment period. There are two kinds of federally protected enrollment periods. The first is your open enrollment period, the 6-month period that begins the month you are 65 or older and enrolled in Medicare Part B. The second type of protected enrollment period is when you have guaranteed issue rights. You have a guaranteed issue right within 63 days of when you lose or end certain kinds of health coverage. Some states offer additional protections as well. Contact your New Mexico SHIP at 1-800-432-2080 to learn about your right to purchase a Medigap policy. Even if you do not have a guaranteed right to buy a Medigap, you may still be able to buy a policy if a company agrees to sell you one. However, know that companies can charge you a higher price because of your health status or other reasons. Point 3, know how to choose a Medigap policy. You should think about your monthly budget, expenses, and healthcare needs when considering if a Medigap is the right choice for you, and if so, which policy best meets your needs. You can call your SHIP to discuss the decision more with a counselor. Here are some questions to keep in mind. Am I enrolling while I am in my open enrollment period? If not, do I have a guaranteed issue right? What is the Medigap policy's monthly premium? How are premiums set? Does the policy impose a waiting period before covering services related to pre-existing conditions? How do costs and provider access compare with a Medigap versus a Medicare Advantage plan? Point 4, be aware of misleading Medigap marketing practices and violations. When comparing or enrolling in Medigap plans, it is important to know that plans, plan representatives, agents, and brokers must follow federal guidelines when marketing to you. For example, it is a violation to try to sell you a Medigap policy if you have a Medicare Advantage plan. You cannot have both. Medicare has marketing guidelines to protect consumers. Here are some red flags to look out for. An insurance company representative knowingly provides you with misleading Medigap information. You feel forced, pressured, or threatened to purchase a recommend a Medigap policy. You are contacted by someone who does not disclose to you that they are trying to sell you a Medigap policy. You are told you cannot keep or purchase a Medigap policy that covers the Part B deductible, even though you became newly eligible for Medicare prior to January 1st of 2020. Take action. Contact your state health insurance assistance program, SHIP, at 1-800-432-2080, or visit the New Mexico website at https://aging.nm.gov to learn about the Medigap rules in New Mexico and to get help comparing plan options. Go to the Medicare.gov website for online help comparing Medigap plans in New Mexico. If you decide to purchase a Medigap, call the plan directly to purchase the policy. Contact the Senior Medical Patrol, also known as SMP, to report potential Medicare fraud, errors, or abuse. For assistance with any Medicare issues, call our local New Mexico SHIP at 1-800-432-2080. Live web chat is also available at https://aging.nm.gov. Thank you for joining me for this update on Medigap, and join us next month for fall open enrollment.